about the right to health. We'll tackle here definitions and the background about it, health and human rights, the right to health, key aspects of the right to health. And after that, Anna will proceed with mental health and stigma, and will talk to you about why mental health and stigma is important, levels of stigma, and contributing factors and consequences. So first of all, we will talk about the right to health. Before starting with the session, I would like you to answer one question for me. Anna, can you hear Google Club?
Yes. So we will be using Google Club in this session. So I will just share my screen. If you can grab your mobile phone and search Google Club and use the code we have. So the code is stigma, by the way. So if you can connect to this thingy, it's basically www.wooclub.com/stigma. If you're on your phone, you don't need to log in, just type the word stigma on top and you should be fine. If you're all right, just write a yes in the chat box so that we know if people are done doing that.
And while you're accessing the Wolf Club, you can already start thinking about the question. And this is, why do medical practitioners need to know about human rights? What is your opinion?
So if you're in Google Club, please type a yes in the chat box so that we know. Oops, what happened? Oh, no. Just a moment. Oh. Okay. All right, so people are joining.
To the people who just joined, please go to Book Club and enter the code stigma and think about the first question, why do medical practitioners need to know about human rights?
I believe you can answer as well, just the first column though. So if you have any troubles, please let me know.
Don't be shy, there is no right or wrong answer. This is more about reflection. Together, why you think this is important.
Elena, do you want to start reading because they will grow and I will need to scroll down to read them all?
Oh yeah, it is obvious that their job is all about human, because they can help others better, because human rights belong to all people, to raise awareness in order to respect the patient's human rights, as well as protect their own. So they're more self-conscious towards their practices of medicine without violating patients' rights, to enable fair treatment of all. It's quite important considering the fact that we have humans day in and day out, because they all have an impact on health, because human rights are universal. Each and every person, patient or not, have rights to behave and act appropriate for these rights, because they have to be sure that they are doing things within human rights, to provide equal treatment. I can read it. There's a people who are entering are always shown there. I can read it out. To provide equal treatment. I'm sorry, I can see it. To all kind of humans, like physically challenged, LGBTQ+ community, etc. It guarantees a system of health protection for all to practice their job properly without human rights. Can you scroll down?
I think I cannot. Without human rights on an individual level, you can't build a healthy doctor-patient relationship.
Okay, perfect.
And there's one more. I think it's important because human rights belong to all people and not everyone knows about them.
Okay, perfect. I think you all have a very good idea already about why medical practitioners need to know about human rights, and we will proceed now with presentation. Okay, why we are talking about this now. As human beings, our health and the health of those who we care about is a matter of daily concern to us. And it's regardless of our age, our gender, our socioeconomic or ethnic background. All of us consider our health to be a very basic and essential asset. When we're ill, on the other hand, this can keep us from a lot of things, like social participation. We might, for example, not be able to go to work or meet with friends or enjoy activities that are offered in our community. And all of these factors have a huge impact on our well-being. And therefore, when we talk about well-being, health is very often what we have in mind. Now, when we talk about the definition of health, the medical definition of health is when you Google, the very first thing you will see is the state of being free from illness or injury. Now, this is a bit in contrast to what I just said, and this gap that you can see here was tackled by the World Health Organization. And the WHO developed, more or less developed a fundamental understanding of health, and it considered and recognized that health is dependent on well-being and consists of interrelated physical, psychological, and social factors. So the WHO definition of health is a state of complete physical, mental, and social well-being, and not merely the absence of disease and infirmity. So you can see that this definition of the WHO contains a more holistic concept of health, which means that health is a relative state in which one is able to function well, not only physically, but mentally, socially, and even spiritually, to express all your potentials, but within the environment in which one lives, without limitations or restrictions. So yeah, this is the definition of health, which is very important, which the following session is built on. Now another question to you. When we're talking about health and we talk about human rights and health, what do you think is the relevance of human rights to health? You can answer this again in the book club.
If you haven't reached the site yet, just type www.bookclub.com, ideally in your mobile phone /stigma, and you will reach it very easily.
access to health care. When human rights are taken away from one, it can have direct or indirect damage to one's well-being. Very true. This is a very central point when it comes to the relation of health and human rights. Any more ideas? It is very important to guarantee that everyone has access to health. Yeah, that's one of the fundamental aspects of the right to health. Help people from the rejection of health care. Yes. I'll give you one more minute to think about it. In order to avoid humans' physical abuse. Also a good point. Maybe one more. I again can't see it.
Because states need to ensure that good health as a human right is protected and promoted. And then there's making sure that everyone can have an access without looking at their race, sexuality, etc.
Yeah, that's non-discriminatory. Very important point.
They're interconnected directly in that meaning that everyone has the right to be treated.
Okay. I think we'll move on now.
Yeah, there are two more if you want me to.
Oh, yeah.
They're interconnected directly in that, Still to this day, people around the world are denied or can't even afford a decent health. So that was it. I believe we can move on.
Yes. Just need a second to share the screen again.
Sure.
Okay. Now, when we talk about the relation and the connection of health and human rights, this will lead us to the Universal Declaration of Human Rights, and more specifically, Article 25. Article 25 tackles the importance of health and its interrelated factors. And it states that everyone has the right to a standard of living adequate for the health and well-being of himself and of his family, including food, clothing, housing, and medical care, and necessary social services. As you might already know, one of the fundamental aspects of human rights is the fact that they are interdependent. This means that the enjoyment of one human right depends on the enjoyment of another, which was already mentioned in the book club by one of you. And it's important to note that health plays a crucial role in this whole construct, because when the right to health is violated, this automatically will lead to a violation to a lot of other human rights. So, for example, the right to water, or an adequate standard of living, or participation, or privacy, or many, many others in many different ways. To get a better grasp of how health and human rights are interrelated, I would like to introduce to you three aspects on how they are linked. And this you can see in this picture. The three main sectors that are displayed here is that human rights violations result in ill health. And this can have various implications, meaning that, or reasons, for example, harmful traditional practices, or violence against children and women, slavery, torture. All of these are results of human rights violations, and lead to an ill health outcome of the affected person. A second pillar is the promotion or violation of human rights through health development, so both positive or negative effects. This is titled in the right to participation, freedom from discrimination, which is a really central aspect of human rights. Then the right to information or the right to privacy. And the third pillar is reducing vulnerability to ill health through human rights. Again, freedom from discrimination, the right to food and nutrition, the right to education, which will lead to a healthier community as well. And last but not least, the right to health, which we will now talk a little bit more in depth about. So, the right to health. The right to health is a very fundamental part of our human rights, as you might already noticed through the last slide with the interrelation. And it's also very fundamental of our understanding of a life in dignity. Internationally, the right to health was first mentioned in the Constitution of the World Health Organization in 1946, and the preamble states that the enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being, without distinction of race, religion, political belief, economic or social condition. And since this was defined in 1946, many other international human rights treaties have also recognized or referred to the right to health or of smaller elements of it. And which I think is really interesting and important to note as well is that the right to health is more or less relevant to all states, because more or less every state has at one point ratified at least one international human rights treaty that recognizes the right to health. And additionally to that, many states have committed themselves to protecting this right through various tools, for example, through international declarations or through domestic legislations and policies. And there's an endless list on how the right to health is tackled in different treaties. So governments all around the world have pledged to protect and abide by the right to health. But of course, this doesn't mean that everyone can enjoy the right to health or that it is guaranteed, even though the governments have pledged to protect the right to health. So, but what does the right to health affect or include? So we want to talk about the key aspects of the right to health. We just talked about the WHO Constitution preamble, and through this we can more or less define the right to health as a right to the enjoyment of a range of facilities, goods, services, and conditions necessary for the realization of the highest attainable standard of health. This means that the right to health is a right to health care and a right to the underlying determinants of health. At this point, I want to point out and highlight that when we talk about the right to health, it is very, very important to understand that the right to health is not a right to be healthy. This has a number of reasons, but one of the main is that good health is influenced by various numbers of factors, for example, the underlying determinants of health. And the government can't control or affect these some of these factors. For example, risky lifestyles or genetics. So yeah, the right to health is not a right to be healthy, but it's a right to the highest attainable standard of physical and mental health. Okay, now I want to talk about the underlying social determinants and how they affect health and are linked to human rights. But first, health determinants. Health determinants, or a health determinant, is a force or an element that affects health in a positive or a negative way. And health determinants are either intrinsic or extrinsic. Intrinsic factors can, for example, be genetics or culture or habits, or your lifestyle. And extrinsic factors include, for example, the health sector and its promotional aspects. And also forces outside of the health factor, for example, the economy or social structures or the environment or technology. So all of this concludes that the right to health is a very inclusive right. So we have to take care of a lot of aspects. This needs to be said because we tend to associate the right to health with access to healthcare and the building of hospitals, which is to an extent correct, but as you know and see through underlying social determinants, the right to health has other aspects as well, and it extends way further than only to access to healthcare. So the social determinants are a wide range of factors which can help us lead a healthy life. Those determinants are conditions which people are born in or grow in, live in, work and age in. And these determinants these conditions are shaped by the distribution of many different factors, for example, money or power, the resources a nation or a family have, or the community has. The social determinants of health are mostly responsible for health inequities and the unfair and avoidable difference in health status that we can often see within communities or between countries. Yeah, I don't think I need to go deeper into the social determinants because they might be already known by you. Yeah, but I want to move on to what the right to health contains besides the social determinants of health. And the right to health on one hand contains freedoms. Those were already mentioned as well in the picture we've seen before with the link between human rights and health. For example, those freedoms include that people are free from torture or cruel, inhuman, and degrading treatment or punishment, but also to be free from non-consensual medical treatment, for example, medical experiments and research or forced sterilization and all things you can think of that people don't willingly consent to. Another thing is that the right to health contains entitlements. These entitlements include, but are not limited to, the right to a system of health protection providing equality of opportunity for everyone to enjoy the highest attainable level of health. Those entitlements also include the right to prevention, treatment, and control of diseases, the access to basic medicine, reproductive health, what else? That everyone can equally access health services, and that everyone in a population can participate in the decision-making regarding health related questions. One point you also mentioned before, and that I want to highlight here again, is that health services, goods, and facilities must all be provided without any discrimination, because non-discrimination is a key principle in human rights and is very crucial to the enjoyment of the right to the highest attainable standard of health. Okay, I have one last question for you. I would like to briefly tackle the AAAQ framework. Some might already have heard about it, some not. The AAAQ framework defines 4 principles how health facilities need to be. So 3 A's. Yeah, okay. We already have it. Great. So we have someone who already knows about it. The AAAQ exactly covers accessibility, availability, and acceptability. Sorry, I can't focus on being both sharing.
Yeah.
Available, accessible, acceptable, and good quality. Meaning, for those of you who haven't heard about it before, very quickly, availability means that functioning healthcare facilities and services must be available in a sufficient quantity within a state. They need to be accessible physically, which means they need to be in safe reach for all sections of the population, meaning children, disabled people, older persons, and every other vulnerable group you can think of. But it also needs to be accessible in a financial way. This means that everyone needs to be able to afford it. Then it needs to be acceptable. This mainly aims to ensure that facilities need to respect medical ethics, be gender sensitive, and culturally appropriate. And finally, they must be scientifically and medically appropriate and of good quality. This includes trained health professionals, scientifically approved drugs and equipment. The sanitation needs to be good, and all in all, it needs to be in a safe working environment. So yeah, this was a brief overview over the right to health. And in case you are wondering why we talk about it when we want to talk about mental health and human rights, think again about the definition of the right to health, which said that that the highest attainable standard of physical and mental health is needed, or should be given at any point. So at this point, I'd like to say thank you, and I will give the word to Anna.
Thank you, Elena, again for being here with us. If there are any questions that you want to address on the right to health, you can ask them right now to Elena, because we will move on with the mental health and stigma part right now. Elena, if you can keep sharing your screen, it would be perfect.
Yes,
so they can, yeah, so they can. I can present Google Club when necessary. But first, are there any questions right now, or should we wait for the end?
I guess not.
Yeah, I can see none in the chat, but if there are any questions, please just write them down and we can address them at the end. Yeah, and also please, if I speak too fast or if there's anything that you want to clarify, please ask in the chat again. And yeah, that's it. So let's go back to WooClub for a few moments again. And I would like you to think, why do you think stigma is relevant to us as future medical practitioners? Let me share the screen again. Yeah, I'm sorry. Yep. So why do you think stigma is relevant to us as future medical practitioners? You can take some moments to think about it, and if you would like to answer. Someone says it can influence how treat your patients. Being aware of your own stigma helps to eliminate discriminations. These are very true. Stigma disallows one to acknowledge that they have a problem, therefore not seeking out treatment. That's true as well, both for patients and for healthcare practitioners themselves. Being aware of own bias, true that as well, to provide full healthcare support. Yes, of course, as Elena mentioned earlier, health is not just physical, but also mental and social health. Stigma is one of the biggest social factors limiting one's right to healthcare. That's right. I guess it's in the messages that we couldn't find earlier the answers. It's crucial for the patient because the knowledge of human rights. No, this is not the answer right now. It is important in creating and preserve a good patient-doctor relationship. I guess this is the one. But let's go back to the question. Yeah. Stigma, no, so we can prevent, so that we can prevent stigma if that's possible. If there are any other answers, keep them coming for some more seconds. And we can move on with the presentation. People, they are being stigmatized. Fear, because we fear stigma, because patients fear stigma. I believe we can discuss about it later on. It's interesting, that's one word. Okay, so if you can present your screen again, Elena. So we will begin with some basics. As in the definition of mental health. So what is mental health? Basically, it includes our emotional, psychological, and social well-being, and it affects how we think, feel, and act. And it also helps us to determine how we handle stress, relate to others, and make choices. And as per WHO, mental health is a state of well-being in which every individual realizes his or her own potentials and can cope with the normal stresses of life, whereas they can work productively, fruitfully, being able to make a contribution to their own community. So why is it important to point it out here is that, as we mentioned earlier, the definition of health itself incorporates the importance of mental well-being, and it emphasizes the unbreakable interconnection between physical, mental, and social health. So in this way, it is clear that in order to achieve health, all three must be taken care of. And also, as Selena bridged between the two parts, it's implied that mental health relies on a wide array of supports and resources, so that if these factors are included, basically if health, if the availability of adequate housing, if just and favorable conditions for work, if freedom from discrimination, if all these are covered, mental health can be easier achieved and human rights are not violated in a way. Just a moment, yeah. Thank you. So why mental health and stigma? Why will we talk about mental health and stigma? Here you can see some facts from a research that was done, if I'm not mistaken, in Canada, this one. So basically mental illness related stigma, including that which exists in the healthcare system that we will mainly focus on. I'm sorry, I will mute you for, thank you. Yeah, so the mental illness related stigma, focusing mainly on this, on the one that exists in the healthcare system and among healthcare providers, is a major concern for healthcare practitioners themselves, both in the workplace culture, but as a barrier for help seeking for themselves, as I mentioned earlier. So it was basically identified as a major barrier to access treatment and recovery, as well as it was correlated to poor quality of physical care for persons with mental illness. And also stigma impacts help-seeking behaviors of health providers themselves and negatively mediates their work environment. So even though stigma may be experienced in all spheres of life, in health facilities it is particularly egregious and is negatively affecting people seeking health services, either by, basically it is documented that it can range, the effects it can have, we'll talk about them later on, but it can take various dimensions, from subtle forms from the denial of care to the provision of substandard care, to physical and verbal abuse, to I don't know, passing their care off to junior colleagues. And as a result, stigma is barrier to care for people seeking services. And when someone has a mental health problem, usually they're at their most vulnerable, but at the same time they cannot access the adequate healthcare services they would be aiming for. And one of the main reasons mental illness is subjected to stigma is because healthcare providers usually fear, and I guess that's what that person was meaning before, they fear either the individual or the behavior that might be unexpected. So moving on, I want us to discuss basically the definitions around stigma and some concepts around stigma. So here you can see, basically here we will discuss slightly the differences between stigma and discrimination, and some points that stigma, so the stages basically of which someone needs to pass in order to gain stigma, let's say. So there was a guy named Goffman who was, I think, a sociologist, and he conceptualized stigma as a complex social process of labeling, othering, devaluating, and discriminating. So he interconnected all these cognitive, emotional, and behavioral components. And then there were two other people, I think, again, sociologists, who defined stigma as the co-occurrence of 5 components. You can see the first one here, which is separation. Basically, what is separation? It is labeling one out of the group. And then the second one is labeling. So basically labeling the differences as negative. The third one is stereotyping, basically separating us from them. And the fourth one that combines two aspects: is status laws and discrimination, which basically separation, labeling, and stereotyping lead to this, these two. And stigma, as we call it in everyday life, is more of a mark of disgrace that sets a person apart from the others. And when a person is labeled by their illness rather than who they are as an individual, they are no longer seen as an individual, but as a part of a stereotyped group. That's why negative attitudes and belief towards this group create prejudice, which leads to negative actions and discrimination. For example, because some people can't understand why calling someone psychotic or neurotic or I don't know, crazy, why it can correlate to stigma, because it's seeing their mental health condition rather than the person. So instead of psychotic, we should mention better a person experiencing psychosis. And when someone treats you negatively because of your mental illness, that is discrimination. And that is exactly what we are going to see in the next, in 2 more slides, yep. Because first I want us to explain the levels of stigma, because so basically now we explained the stages, let's say, at which when we are, I don't know, infants or babies, or anyway in the process of being alive, stigma is created, but stigma actually coexists simultaneously in 3 levels, and that is intrapersonal, interpersonal, and structural. And we shall begin with structural stigma, which refers to discriminatory social structures, policy, and legislation. So basically, we have some laws, some policies that contribute to health disparities for some populations. For instance, African Americans, or like for lower quality care for elderly people, because there isn't something that states equity between elderly people and young. So since everyone is granted the same access to healthcare, there's lower quality of care for elderly people. So in the case of mental illness, structural discrimination can be seen in the disparity between physical and mental health care provision that results in poor quality and scarce mental health services, and in the fact that poor coverage of mental health education is in our university curricula for health professionals, that we over-rely on institutional care, and that we have limited resources. We have limited adjustments to ensure equal access to physical care rather than mental care. Moving on to the second level of stigma, that is an interpersonal stigma. Basically, this one consists of the knowledge, the attitudes, and the behaviors. As I mentioned earlier, knowledge, basically, when referring to knowledge, we mean ignorance or misinformation. When we say attitudes, we mean prejudice. Attitudes mean prejudice basically is how you feel about a certain situation, and behavior then is the discrimination or basically acting based on your prejudice, or targeted violence in some cases, or human rights abuses. And although we would expect healthcare professionals being more knowledgeable of mental illness than the general public, we see that they sometimes are lacking knowledge, which is related to stigma, and especially for some mental health diseases. And moving on to the third level, being the intrapersonal level, basically this one is both the self-stigma and the internalized stigma. So these are not very well differentiated, but basically it's the negative beliefs someone has about themselves, which are largely based on shame and on accepting mental illness stereotypes, the sense of alienation from others, and consequent low mood. And this can negatively correlate with measures of empowerment and can be conceived as its opposite. And healthcare professionals' behavior might either exacerbate or ameliorate self-stigma, because it's the intrapersonal level, is their patients' intrapersonal level of stigma can be either let's say relieved or get worse because of their doctors' attitude. I think there's a question, so oh, that's I think for later on. I guess they are, aren't they? Yeah, okay. All right, so just for you to understand a bit better in the healthcare, in the mental health aspect, the structural stigma may exist in the, for instance, in the way resources are invested, or on the quality of care standards, or on organizational culture. The interpersonal is more like the patient-doctor relationship, the discriminatory behaviors, and the negative attitudes. Whereas on the individual level, we have the self-stigma, or the patient reluctance to seek care, exactly because they have self-stigma for themselves, or the provider reluctance to disclose a mental illness and or seek care, exactly because they have this self-stigma that when they seek care, they will be misjudged by their colleagues. So moving on to the next slide, I don't want us to pay much attention to this one. No, the previous, yeah, thank you. I just want you to see that on the vertical axis, we have the social cognitive structures, which is stereotypes and prejudice, and which are separated from discrimination. And on the horizontal axis, we have types of stigma. This is a different division of stigma, let's say, of the types of stigma, the levels of stigma. Here we have public, self, label avoidance, and structural. But you can understand the differences between having a stereotype or being prejudiced towards a situation, and what is the difference to discrimination for each one. Yeah, but I think because we're already a bit late, let's not stay too much on this. Yeah. Now I'd like to ask you to go back to WooClub and ask you, why do you think people with mental health conditions are stigmatized after what you've heard? Let me share my screen as well. There is a common belief that people with mental health issues can exaggerate their symptoms. That's true. Because stigma is a way of avoiding the existing issue. That's an interesting view. Because people doesn't have knowledge about the illnesses they are dealing with, and they are afraid. Yeah, so it can be due to lack of knowledge or fear of the unknown sometimes, and also avoidance, as mentioned above, and also the fact that some things are exaggerated either because of a condition or because that's a idea people have for a condition, because of the lack of knowledge in the mental disease, because they're not used to treating such people. True. So lack of experience perhaps, or training, or present. Yeah. People with mental illness are seen as less reliable, which prevents them from being taken seriously, because they outstand from us and we are not ready to accept the fact at times. And here I just want to make a quick remark that because it says from us that anyone can acquire a mental health problem. So let's just not use the they and us, because exactly that's one of the processes we can roll down to stigma. But yeah, that's true. That's they seem different. People suffering from mental illness are seen as more dangerous. That's true. So true. There's one message, because link them to stories that they have heard or events that have happened in the past. That's true, because of, yeah, lack of awareness again. Oops, wow. Oh, lying and aggravations of symptoms. Okay. Let me wait a few more seconds and see if there's anything else. Fault and deserve it. I'm not sure what this means, but oh, that it's their fault and they deserve it, that they have a mental health condition. Maybe. I don't know if many people believe that, but yeah, true. And one last, because mentally ill people have different needs which ordinary people cannot recognize. Yeah, I believe so. Again, let's try to be mindful of the language. Of course, it's difficult, but sometimes using words such as ordinary or them and us might kind of exacerbate stigma. So just have it in mind that, yeah. So yeah, now we'll go over the factors contributing to stigma. Yeah, so according to a research that was conducted, I'm not sure where, this one, it was identified that the number of issues contributing to stigmatization in healthcare might actually have direct and indirect impacts on access and quality of care for persons living with mental illnesses. So the first factor is, as you mentioned, negative attitudes and behavior. So people with lived experience of a mental illness commonly report feeling devalued, dismissed, or dehumanized by many of the health professionals with whom they come into contact, because either they feel excluded from decisions or receiving subtle or overt threats of coercive treatment, being made to wait excessively when seeking help or given insufficient information, being treated in a paternalistic way, or being spoken to or about using stigmatizing language. So this can lead to someone, yeah, we will see the impacts stigma has, but yeah, this is one of the major factors contributing to stigma. And researchers show that these stigmatizing attitudes and behaviors exist across the spectrum of healthcare. So it's not just in psychiatric wards, which is actually, the percentages are actually a bit higher, which is a bit shocking, taking into consideration that these people were trained. And also burnout and compassion fatigue have been identified as exacerbating concerns. Yeah, so that's the first one. The second one is lack of awareness. So it could be unconscious biases. So hidden beliefs and attitudes of someone can underlie stigma-related behavior. And it was actually proven that once doctors were trained for, were anti-stigma trained, let's say, they became aware of these subtle and unintended ways they were using, contributing to stigmatizing experiences among their patients. The third one is therapeutic pessimism. So there was a research again showing that basically healthcare providers having pessimistic views about the reality and likelihood of recovery, which is experienced as a source of stigma and a barrier to recovery for people seeking help for mental illness. And also pessimism about recovery for some providers is associated with the sense of helplessness and that they can't do something about the matter. Another factor contributing to stigma is lack of skills. So inadequate skills and training seem to be associated with stigmatization. Firstly, by like that the fear or anxiety and the desire to avoid, because they can negatively impact patient. the healthcare practitioners fear or are anxious that they are not skilled and capable enough of providing these goods to their patients, and that less effective treatment can have poor outcomes. And the last factor contributing to stigma based on that research is that stigma is kind of a workplace culture, so that it's not just an outward facing mental illness, but basically that it penetrates the healthcare sector as a workplace per se. So that again, this research in Canada indicated the level of stigma regarding their own willingness to disclose for healthcare providers. The level of stigma regarding their own willingness to disclose and or seek help was consistently higher than their level of stigma for other dimensions. So yeah. Are there any questions before we move on to the consequences? And I mean, is any of the questions, should I go over them? And is any of the questions on the above, or should I go on and we can see them later? Yeah, I believe we can go on. Okay, so for a final time in Go Club, I'd like you to mention the consequences you believe someone can have on the personal level. So how do you think stigma affects the lives of people with mental health conditions in their everyday life? Mental illness may prevent one from accessing healthcare because of fear of rejection, discrimination. Yes, true. Feel more fear to approach healthcare and other needs. They feel desperate and nothing and nobody will help them. That's true. Also think about more general aspects of their everyday life. What else can be affected due to stigma? People with mental illness feel judgment from others in their daily life. Yes. They can't find a job. Yes, exactly. They may be rejected by friends, family. Yeah. They might have problems with education. Yes. Feel less confident and consider themselves as burden to others of the society. That's again true. Not having their symptoms taken seriously. Yes, in some cases that's true as well. They tend to lie about themselves, trying to hide the truth about them. Yes, also that's usually a result of self-stigma. Can't find work easily. Yes, tends to get isolated. Yes, and let me check the messages. We all have a mental health condition, but if we are stigmatized because of that, even if it is not done on purpose, it brings the worst out of every individual. That's an interesting perception. Let's place it not a mental health condition, but like we all have mental health, that's a fact. So developing a mental health problem is not uncommon as well. Yeah, and I believe that's it. If there's anything else, you can type it in for the next 20 seconds. As I will drink water. And people may feel lonelier and distance themselves from the society more. People calling them crazy, psychotic. Yes, for both, it can worsen their mental health. Yes, exactly. That's indeed true. Okay, so in order for us not to be very late, let's keep moving. So I don't have a slide for the personal level of the consequences, but all the ones that you mentioned were correct. And I believe okay, so let me go over them very quickly. So difficulty in finding and keeping a job, as you mentioned, isolation from friends, family and daily activities, harder to stay in a stable long-term relationship, fear to open up to professionals, family and friends about mental ill health, anxiety about health due to overwhelming belief of not being listened to, avoiding speaking to doctors about mental health concerns, which means treatment and care is not given, making excuses for not going out places due to the fear of telling people about feeling unwell mentally, low self-esteem from believing that the stereotypes portrayed about mental ill health, physical health can be affected too, and negative experiences make it harder to ask for help. So moving on to the consequences on the healthcare sector, we can kind of divide them into 3 categories. They're the ones that regard the access to healthcare. So as we mentioned earlier, basically we mentioned some of them earlier, but this might be delays in help seeking. The factors that we mentioned earlier can lead to these situations, such as delays in seeking for help, or discontinuation of treatment, or suboptimal therapeutic relationships, or patient safety concerns, or poor quality mental and physical care. So sometimes the patient-provider relationship might be compromised and can result to early termination of treatment. And because that's shocking, I think I should share that a survey found that 79% reported first-hand experiences of discrimination towards a patient, and 53% observed other medical providers discriminating against the patient from psychiatry. So I believe the percentages are quite high and shocking. And moving on the second division, let's say, on patient safety, we can see that that's also a barrier. So through factors such as the staff attitude, the attitudes staff has, any healthcare provider that is, or institutional culture. And the third parameter is poor physical care, because as we mentioned earlier, sometimes people who experience mental illness don't have their symptoms taken, their physical, usually symptoms, taken seriously. And they receive poor quality care for their physical health problems. And there's a last bit I wanted to mention, that stigmatization, this time in the health professionals, that basically stigmatization has impacts to health professionals' own willingness to seek help or disclose a mental health problem, as we mentioned before, because which can result basically in an over-reliance to self-treatment, low peer support, because they might be ostracized or judged from their co-workers, and there's an increased risk for suicide. And this can be also found in the WHO report of 2018, if I'm not mistaken, on mental health of healthcare professionals. So basically, initial reluctance to seek help. So basically, let me describe a logical pattern that usually occurs when someone in the healthcare sector has to face a mental health problem. There's this initial reluctance to seek for help, which may result in decreased productivity, which may lead to people confirming the stereotypes and pushing even more stigma to them to seek for help. And I think the last bit will be your favorite. As I've seen from the pre-evaluation questionnaire, that's the one most of you had as the lowest knowledge or relevance to. So basically, again, the how to tackle stigma, there are 3 parameters we should take into consideration. The first one is social contact. Oops, okay, thank you. So the first one is social contact. This is when conversations happen. Just a moment. I think I've done something. Can you still see the share screen? Yeah, I think you can. Okay. Yeah, so the social contact is when conversations happen between those who experience mental health problems and those who do not. So social contact basically means listening to, watching, or reading someone's experiences. And it works because it focuses on the people and not the labels of the mental illness. And this means that negative assumptions and attitudes can be challenged. And what are the methods to reduce this stigma? Basically, it's get in touch with stigmatized group, which relies on involving members of the stigmatized group in the delivery of interventions to develop empathy and humanize the stigmatized individual, break down the stereotypes, basically. And the other method that is pretty similar is bringing health workers and clients together for stigma reduction, and basically trying to empower people or groups experiencing stigma by building skills and efficacy to address internalized stigma and cope with and challenge stigma, and building partnerships with gatekeepers and opinion leaders for change. What the second part means is making bridges between healthcare professionals and patients, and try to focus more on their interpersonal relationships, so as to be to bridge and to kind of break down both individuals' stigma. The second part is education, and education basically seeks to replace stigmatizing attitudes with accurate representations of mental health. And there are various methods. I'll just go briefly over them. Is the provision of information, so consistent information and reliable information that can also focus on stigma. There are skills building activities to develop for healthcare professionals to develop the adequate skills, participatory learning, so approach basically requiring participants to engage in interventions, and as mentioned also earlier, empowerment, which is basically to improve patient coping mechanisms to overcome stigma at the health facility level, and utilizing technology for stigma reduction, basically by self-learning. And the third part is a bit weird, or if you're already in a youth organization, it will sound actually quite familiar, is advocacy interventions or protest. The protest is the most common for people who are demanding something on a larger scale, for instance, for climate change or something. But there's also the advocacy part and the intervention part. So basically, structural or policy change, trying to approach the stakeholders who are responsible and try to include stigma and mental health in policies and make everything more inclusive, and addressing health facility stigma at multiple levels by intervening at either the individual, so co-workers, or the structural level, basically the health facility policy and environment. Yeah, that's it for me as well. Thank you for listening. Yeah, and that's a small take-home message, if you'd like. The Smashing the Stigma. It's a small acronym. It says WALS, and it stands for words. So make sure you're not using language or comments that stigmatize people. Ask. So ask questions. Someone who is willing to share their experience, or a health professional who is knowledgeable on the matter. Learn. So there are lots of resources. So try to educate yourself. Listen when someone is sharing. Show support, and if you've experienced something similar, you can also share, and speak when you hear others being stigmatizing towards people. Yeah. So I hope we weren't too tiring. I've been speaking for a while now. So now you can all ask your questions. Elena, do you want to basically? Okay, I can start going over them.
The first one that was posted was, I already saw it, I just need to scroll there. I think that was addressed to my part. How can people in countries where certain practices like abortion or is not allowed or isn't easier as happening avail their right to health? I saw this question when Anna began talking, and I've been thinking about it for a while. It's a very, very relevant question, and it's also kind of a hard question to answer. What I didn't mention about the right to health in my presentation was that through the different constitutions and declarations and treaties that were signed and ratified by the states, there are certain instruments in place that contain, that impose obligations on the government. The right to health is formulated very, very broadly. But there are some things that governments need to do to realize, or that they should do and shouldn't do to realize the right to health. And those are basically three obligations they have. The first one is respect the right to health. So they need to refrain from violating the right to health themselves. Then, or not by themselves only, but also by every other person who can act and violate the right to health of a person. The second one is protect, which I mentioned already, which basically covers that they prevent them from others violating the right to health. And the third one is fulfill. And this means that they need to take measures that are necessary for the realization of the right to health. For example, that they adopt new policies to protect the right to health. There are also limitations to that. One is recognized through, it's called progressive realization. And this means that it takes time to implement the right to health. So governments need to show a constant progress and need to make every possible effort to realize the right to health. However, there are certain requirements that they have to ensure immediately. For example, the freedom from discrimination, and that the very, very, very basic level of healthcare and sanitation and drugs are available to everyone. The second one is resource availability. So it's recognized that for some governments or for some states, it's harder to have the resources to provide the necessary healthcare. However, there's another element to the right to health beside that. And this is the most important point when it comes to this question, is accountability, which means that there are procedures which require a government to justify and explain what they're doing to realize the right to health for all. And those mechanisms are crucial. They're the most necessary thing to monitor whether a government is doing what it's supposed to do to realize the right to health or not. So, for example, at a national level, there could be courts or human rights institutions and political procedures that assess the performance of the government. But of course, we all know that this is not happening everywhere. And this is something we need to talk about, that we need to recognize. And I actually would would highlight again what Anna mentioned in the very last part, that not only for mental health, but for health in general, we need to advocate for it. We need to intervene and protest. This is something we can do in our own communities, in our own countries, but we also can advocate for the realization of the right to health in other countries. And this is basically, or in other communities, and this is basically what we in IFMSA and EMSA are aiming to do on an international level. But which is also very important to keep in mind at this point is change should come from within. So the most important thing we can do is empower those people who are affected, who don't have access to the right to health, who can enjoy the right to health, to educate about this and educate about how you can fight for your own rights. I know this, yeah, this sounds very, very hard, and it is to realize it, but this is what we're fighting towards and what we need to do in order to tackle this and ensure that people who live under circumstances and are exposed to practices that are not in line with human rights learn about this and learn to advocate for themselves. Mm-hmm. Does that answer your question?
Perfect, thank you. The second one asks whether when an employer avoids employing someone because of their mental disorder, is that structural or interpersonal stigma? Basically, take into consideration that structural stigma is usually written down. So in the case, a legislation or a policy, either from the company or from the government or from any other structure that is affecting that employer, states that mental health, like people with mental health disorders aren't allowed to work in this company, in this place. This is structural stigma. But in most cases, that's not the case. I mean, structural stigma occurs, but not as such. Like usually, not in that way. It's affecting people with mental health disorders in other ways. So in this case, it's more likely to be interpersonal because, as we mentioned earlier, interpersonal stigma is based on lack of knowledge or wrong attitudes or wrong behaviors. So it's a matter of perception or knowing something wrong from the beginning. I hope that this answers this one. And the third one is not as much relevant to mental health, but it's interesting to see. So how can we as students help people who are stigmatized based on their sexuality? If I may begin, Elena, because like neither of us covered it per se, I would say that the methods are pretty similar to them. How to tackle stigma overall is basically trying to educate people, is trying to get people get along with the ones that are stigmatized, and also by raising policies and by advocating and by raising your voice, either as a youth organization or as a medical student in your institution. So that's usually the tools we have. We can try to raise our voice or try to educate our peers, or like we might even create training programs for others, for doctors or so. But yeah, that's all I can answer to this one. Do you have anything to add, Elena?
No, basically you covered everything. Yeah, I'd like to emphasize again that the most important thing we can do is empower the people so that they can advocate for themselves. It's very important that people realize what they rights are and how they can fight for them.
Mm-hmm.
And this is what we should aim for here as well. What I actually learned along the way, or realized along the way, is that it's very important to start in your own family and friends. Yeah, start with them when you talk to your peers and learn more about what they think, how they think, if there's stigma within your friends and family, and try to learn more about this side of the stigma as well, of the people who do stigmatize people with mental illnesses, or who are stigmatized based on their sexuality, so that you learn how to where the stigma comes from, what the stigma is, and how you can react to it, and maybe educate those people as well, and share your thoughts about it, and maybe you can start a change in their thinking as well.
Mm-hmm. Perfect. If there's any other question, you can write it down. Also, indeed, we've been quite over our time, so I'll just I just saw that there's a question in the form, in the registration form, that's asking what EMSA has been doing in this area, so on mental health and human rights, if we have any policies or for advocacy. And basically I need to answer that this is the first time that we are tackling mental health from the human rights perspective. There is a policy paper that is a bit more general, so we hope to renew it and include the human rights aspects to it, and try to continue with this focus area, let's say. But yeah, we haven't done much on advocacy level yet. We're just trying, like, so next Tuesday, our webinar will be held by mental health Europe professionals, Marcin Rodzinska and Marie Fallon. So Mental Health Europe is our external partner, and we're trying with their collaboration to act more on advocacy on the European level. So yeah. And if you're interested to hear more about the European institutions and the human rights-based approach in general, you can join next week as well. If there are any more questions, you can write them down, and maybe, because we're really over time, maybe we can send them via email. Also, we can provide the handout material with Elena, right? Via email. And basically, yeah, the agenda we prepared, and this recording will be uploaded on YouTube, and I will share the link once it's uploaded. So if there are any questions or anything else technical, you can write it down. Otherwise, thank you for joining. Thank you for being here. Also, thank you again, Elena, for joining me in this. It was very nice working with you.
Thank you as well. I really enjoyed it.
Thank you so much. So have a good evening, I believe. Good night.